Community health centers are designed to cater to the community in which they're located. They provide care to communities with a shortage of healthcare options for the underinsured and uninsured. My name is Heather Keenest, and I am a senior career advisor at Rasmussen University. Joining me today to provide further insight into Minnesota's community health centers is Erica Lester, workforce specialist with Minnesota Association of Community Health Centers. Welcome, Erica.
Hi, Heather. Thanks for having me.
Erica, could you take a minute to share a little bit more with us about your background and how you came to join the team at Minnesota Association of Community Health Centers?
Of course. My background is based mostly in working with communities in a public health setting. I earned my MPH in community health promotion from the University of Minnesota, and while I was there, I did a lot of work with underserved communities here in the Twin Cities area. I have always been interested in community health centers, so I'm thrilled to be working at the Minnesota Association of Community Health Centers.
Thank you, Erica. You know, based on your professional and educational background, I can tell that you're passionate about the work that you do. Now, I am familiar with a couple of the community health centers in the Twin Cities area, but what role does the association play in supporting these centers?
The Minnesota Association of Community Health Centers, or MINAC as we call it, is an organization that supports the state of Minnesota's community health centers in improving and maintaining the health and wellness of their patients and communities. The community health centers in Minnesota serve over 180,000 Minnesotans and employ over 1,700 full-time staff. So we're here to provide any help that our community health centers may need whenever they need it. A community health center is a federally funded healthcare facility that aims to increase access to primary care by reducing barriers such as cost, lack of insurance, distance, and language. The 17 community health centers that comprise this network are located throughout the state of Minnesota and medically underserved areas. The populations that are supported by our community health centers are made up mostly of uninsured or patients that are on Medicaid. And we also see a lot of patients that are below the federal poverty level and are part of racial and ethnic minorities. These community health centers function as a safety net, providing comprehensive primary and preventative medical, dental, and behavioral health services to people who would otherwise lack access to this care.
You know, these are some fantastic statistics about the impact that community health centers really do have on the communities that they serve. I know these slides have definitely taught me a little bit of something. You know, I have to share with you that there are some thoughts out there, and I'd really, venture to say more misconceptions about what it means to work in a community health center. What do you say to someone who might make a statement like, working at a community health center is not as good as working at a hospital or other for-profit institution?
I would say this is definitely untrue. Community health centers offer competitive salaries and benefits, federal and state loan repayment, and great growth opportunities. And on top of that, you're able to give back to your community every day at work and provide health care to those who need it the most.
Fantastic. Okay, now that we have a better understanding about the benefits of working in a community health center, let's review some of the positions available for active job seekers out there. Although we know there's no guarantee of a position with your organization, we always say in career services that you have to sell yourself at the interview. There are many opportunities for candidates to apply to. Job Connect, which is Rasmussen's online job board. You have open healthcare positions listed. That's medical assistants, LPNs, front desk staff, clinical support, and community health workers. Can you share with us exactly what a community health worker is?
A community health worker is someone that acts as a liaison between community members and the community health center, working to form those important connections. And one of the other great things about community health centers is there's such a wide range of positions that are available. In addition to the ones here, there's also custodial staff, interpreters, and IT support, and much more.
Excellent. So it's probably best practice to always be checking your career site on a regular basis, as I'm sure that positions change on a regular basis. All right. So it seems as though there's so many reasons why a candidate would want to become a team member with a community health center. What additional advice or industry trends can you share with us?
COVID-19 has created a lot of changes at Minnesota's community health centers. Now more than ever, there's a need for healthcare professionals that are a part of the very communities that they will serve. COVID-19 has exacerbated many cultural barriers and has created fear in many different populations. In order to create trust and allow people to feel safe seeking care, community health centers have a great need to staff positions with these very people. And the biggest piece of advice I can offer is don't get discouraged. The healthcare industry will always have open positions, especially community health centers. So don't let a rejection turn you off from applying for more.
That's great advice. Absolutely wonderful advice. You know, Erica, thank you so much for being with us today to share a little bit more about the impact that community health centers have and how candidates that are interested in working for those centers can apply. Thanks so much.
Thank you.